So what I'm talking about is generally we talk about trying to brace with our core and our glutes really, and keep our the relationship from your pelvis, right here, your pelvis, with your ribs or chest. It doesn't really matter, but I like to use the landmark closest to the pelvis because it's easier to see. Um, so we'll pick the ribs, right? So pelvic landmark, rib landmark. When we're squatting or deadlifting, really doing anything with some sort of axial loading, we don't, and technically any loading, we don't want excess movement, especially when it's right under the bar, right under the weight, because then that bleeds power, changes mechanics, but also could lead to injury because um, it's not really active or passive, but it's instability in a way that doesn't matter. That's not important. So what I'm talking about is pelvis rib relationship. When we squat, you'll see me take my big brace, and so now I'm braced, ready to go, right? I'm here, and the whole time I can't actually do it. Or even if I'm changing angles, like as I squat, maybe I'm like a super upright squatter, maybe I'm not, and I'm one of these, but the relationship from here and here, the distance never changes. Now what you're doing, and a lot of people do, specifically lighter women with superlordosis, is you'll extend, you'll do everything, right? Or even you'll go down because maybe that's for you, but your relationship as you descend, you go into a anterior pelvic tilt, right? So now, as you descend, your relationship changed. So you're gonna go down, go down, go down, go down, go down, or even rather, sometimes we're really good, right? Our relationship's great, and then we get almost into the hole and we don't have the mobility or the mechanics, whatever it is, and we have to dump into it. So now we went from here to more here. It's obviously an exaggerated angle, but that's what's happening. And you specifically, what's happening is you set up, you do your stuff, and you pelvically tilt where your back goes from like really neutral to here as you descend, so it kind of looks like here. And now that's going to force you to kind of shift forward, right? And then you're going to maintain that like super duper extension because that's technically your most stable position as far as well, it's really your second most stable position, because your most stable position is keeping this like a pillar, like a rock. It doesn't move no matter what part of the movement you're in. This relationship doesn't change. But then you can't maintain that. So your second best after that is hyperextension, because now all your spinal structures and muscles are in complete contraction. They're as a unit, they're as stiff as possible, which is best for force transfer, which is how you squat. You get force applied to the floor and then into the bar, and it goes boom, right? So again, we want to keep pelvis, and is this easier? No, can I squat like that? Yeah, I can really do that. So our relationship, whole way, same. Yeah, see, I can't even do it right now without bracing and all that. So something we can do for that is regress to progress. I know you don't like that, but it is what fixed your deadlift. So what I like to do is, the goblet squat is a good place to start. This is the time to use a mirror or film yourself live where you can kind of see yourself and get visual feedback. Or next time I see you, we can even put tape on, we can pick a set of ribs, put some tape from here to your pelvis, and you'll feel if they change. If they go slack, you'll feel it. If it goes taut, you'll feel it. You'll see how it goes. And then we regress from competition squats to our goblet squat. And if actually your front squat is pretty good, so you can actually regress to the front squat instead. Just it's another step up the pyramid, closer to specificity. So you do your front squat, and you can kind of see and feel how your pelvic relationship doesn't change, because it's easier from a front rack position because you're pillared and your weight is here as opposed to here. So now you're forced to be here, and any deviation, you're gonna fail. And then you go to your comp squat where the bar is back here, and now you're forced to be pitched forward. And now you're actually loaded in a way that makes your body want to be forced to change that mechanic. Your body's gonna want to extend. Some people actually even go that way and tuck. That's actually what I do when I'm not paying attention and I don't brace properly. So, and that can also come from feeding inappropriate slack into your hips, meaning you just don't have the mobility for it. But usually it's mechanical. It's in your brain. You do it. You fuck up like 7 out of the 8 reps, but you get 1 rep. And then the next day you get 2, and then the next week you get 2 or 3, and the next week 4, 5, 6, and all of a sudden you're doing 8s, and then a block and a half in, you're like, oh, boom, 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 boom. And then squats feel good. Everything feels good. You might have less pain, less discomfort, and so that's really what we're looking for.